So let's talk about specifics about what we need to do. I'm Dr. Darren Scott. I've been helping people for 20 years get their life back from chronic conditions like Sibo, hypothyroid, Hashimoto's, autoimmune conditions, all sorts of GI issues. So if you don't know what Sibo is, it's small intestinal bacterial overgrowth. And what happens is the bacteria in your gut will overgrow and actually cause you bloating, constipation. It can cause you diarrhea. It can cause you diarrhea and constipation that goes back and forth. And not only that, it accounts for 60% of all irritable bowel syndrome, IBS cases. So this is a big deal. So how you treat it is first you have to find out why did you develop Sibo. This goes for any of the chronic conditions we deal with. You've got to find out the mechanism that got you there. If you don't figure that out, it's going to come back on you. In fact, Sibo notoriously likes to come back, and that's what happens. Okay, so first find out why you have it, and we'll do a whole nother video about that. Now you're going to have to kill the two types of organisms that typically overgrow in your gut. Number one is the bacteria, which is a hydrogen dominant, and that will usually give you diarrhea. The second one is called archaea. They're not really bacteria. They are an organism, but it's not really a bacteria, but they produce methane. So when you're bloating, blah, right? It's the gas that's produced by these organisms. And so depending on which one you have will really dictate how you kill it. Okay, typically it's going to be prescription or an herbal antibiotic. Prescriptions work, but herbal antibiotics have found to be just a little bit better. It's almost kind of sixes. But we prefer to do the herbal antibiotic because many institutions use that, and it's less damaging to your gut. It's not such a powerful antibiotic that just screws everything up. So herbal antibiotic. How long it takes to kill it? You have to determine from a Sibo test. Depending on how much is overgrown, it could take you 5 months to kill it, or it could take you 4 weeks to kill it. It really just depends on that. So anytime we do treatment, we do it before with a Sibo test. Now here's the sad thing is your GI doctors will not pull a Sibo test. It is very rare that your doctors will even try to pull it, even though it accounts for about 60% of all the cases. So if you're sitting there, you're bloating, constipation, diarrhea, it's going back and forth, you're probably Sibo, and you want to see if it is it, you can go to the link tree in my bio and then click on order Sibo test, and we can get you a Sibo test in just about every single state and in Canada if you're looking to get that. Okay, so you need the test to know exactly how to do it. And then once you confirm that you've killed it, then you have to go into a prevention phase or a repair phase. Now you got to repair the damage that Sibo caused to your gut because you're going to have a leaky gut. You're going to need to fix that. You need to reintroduce the good bacteria. We actually incorporate some neurological exercises for your vagus nerve to get the gut motility going. So there's several things that you have to do depending on what you have is how you're going to prevent it from coming back. Our success rate's like 93% on getting rid of the Sibo, and it is a game changer if you're suffering from that. Lastly is there are some diets that are out there. Very rare do the actual diets kill the Sibo altogether. There is one in particular that could do it for you. It's called the elemental diet, but this sucker is hard to do. You don't eat anything for 2 to maybe 3 weeks. It's brutal. We hardly ever have our patients go through that, but that is something you could look into. But better yet, make sure you get the test and make sure, even if you do that, you got to find out why you developed it and repair the damage. So if you're struggling, you're not getting answers, you need some help, reach out to us, click the link tree in our bio, and you can actually schedule a free discovery call with us, and we'll see where we can help you.